At Arancia, two of the technologies we use most often are Shockwave Therapy and Stimpod Therapy. They work through completely different mechanisms, but both are designed to help support the body's natural healing processes rather than simply covering up symptoms. Let's start with Shockwave Therapy, also known as EPAT. Despite its intimidating name, Shockwave Therapy doesn't shock your body at all. It uses acoustic sound waves that travel into the tissues and create a controlled mechanical stimulus. So that stimulus triggers this sort of cascade of biological responses. So blood vessels start to dilate, cellular activity increases, growth factors are stimulated, collagen is remodeling, and that whole process begins. Areas that may have become fibrotic, restricted, or poorly vascularized or chronically irritated get a fresh signal to encourage repair and adaptation. In many ways, it's kind of like tapping the shoulder of tissue that has stopped responding normally, and it's reminding it to get back into work. This is one of the reasons we are really excited about using it for chronic pelvic pain, for painful scars, tailbone pain, postpartum dysfunction, painful intercourse, endometriosis-related restrictions, pelvic heaviness like prolapse symptoms, and persistent tension patterns that haven't responded to traditional approaches. One of the biggest misconceptions in healthcare is that pain exists in one location. The problem must exist there too. It's not true. The body doesn't work that way. For example, let's talk about a C-section scar. That can influence abdominal mobility many years later. Restrictions around the pelvis can even alter how your force transmits in through the hips and spine. Changes in tissue mobility can affect your posture and management throughout your core system. Everything is connected. Then there's something else called Stimpod. That addresses an entirely different piece of the puzzle. If Shockwave Therapy focuses on tissue health, Stimpod focuses on communication. Your nervous system is constantly sending information between your brain, your organs, muscles, your pelvic floor, and every other structure in your body. Every bladder urge, every muscle contraction, every single sensation, every movement you make, every protective response, it is all communication. When those signals become distorted, interrupted, hypertensive, or irritated, inefficient symptoms can become available and appearing for unrelated causes, like a bladder constantly feeling urgent, or pelvic pain that appears without any explanation, persistent muscles guarding, burning sensations even, tailbone pain, sensitivity during intimacy, incomplete bladder or bowel emptying, symptoms that tend to move around, or symptoms that just don't make sense. Stimpod uses pulse radio frequency stimulation to interact with the nervous system and help support healthier communication along these pathways. What really fascinates patients most is realizing that we don't always treat where your symptoms are felt. Someone struggling with bladder urgency may be receiving treatment near their ankle because of the neurologic connection influencing your bladder control. Someone experiencing pelvic pain may be having contributing dysfunction occurring elsewhere along the nerve pathway. The human body is so further past interconnected and far more interconnected than people realize. That's exactly why diagnoses alone really tell the whole story. The diagnosis tells us what's happening. Our job is to figure out why it's happening. That's why every patient who comes to our clinic begins with a comprehensive head-to-toe assessment. Really, we don't want to just look at the pelvic floor. We evaluate how your entire system is functioning together. That way, we know how you move, and we can look at how you breathe, how you manage pressure in your body, how scars are influencing mobility, how your nervous system is responding to it all, how your symptoms fit into the bigger picture, and only then do we build a treatment plan from that point on, not based on a protocol, not based on what worked for someone else, and it's more based on your body individually, your goals, your history, and the specific factors contributing to your symptoms.